Hello, my name is Saish Yennampelli, and today I will be talking about how U.S. Supreme Court decisions influence physician-assisted suicide. Physician-assisted suicide is when a physician prescribes a patient a lethal drug, fully aware of the patient's intent on committing suicide. Physician-assisted suicide has always been looked down upon, but the opinion of the public is changing as they now take into consideration the feelings of those who are terminally ill. Understanding physician-assisted suicide is so important as currently terminally ill patients are restricted from their desire to die. Some argue that this is a violation of a person's rights and liberty, which is what this research is centered upon. To gather this information, a search was conducted using keywords such as physician-assisted suicide, death with dignity, right to privacy, and many more. This research was conducted based on 13 studies. These 13 studies were broken down into two categories. The first category focused upon United States Supreme Court cases relating to physician-assisted suicide, and the second category focused upon the right to privacy. Both of these categories are important to a review of physician-assisted suicide. From these 13 studies researched, one would be able to deduce that the court tended to decide that physician-assisted suicide is not a favorable course of action, and that a state's ban on physician-assisted suicide is indeed rational. This is because the court decided that a state's ban on physician-assisted suicide is in place to protect the lives of people and preserve medical ethics. However, attitudes towards physician-assisted suicide have begun changing as people recognize that physician-assisted suicide can indeed help people. This change has brought 9 states to fully legalize physician-assisted suicide with the Death with Dignity Act. On your left, you can see a graph that shows the increasing support for physician-assisted suicide, and on your right, you can see a graph with all the states that have fully legalized physician-assisted suicide. The states in red show the states that have fully legalized physician-assisted suicide, while the states in blue show the states that are right now considering legalizing physician-assisted suicide. The USSC cases on physician-assisted suicide have many influences. Lochner v. New York introduced Justice Harlan's methods of making the party challenging the law prove that the law is unrational instead of the government proving that a law is indeed rational. This practice is still used today. Cruzan v. Director, the Missouri Department of Health, decided that a family cannot choose to stop life-saving treatment for terminally ill patients, as a family may not always choose something in the patient's favor. Washington v. Glucksberg and Vaco v. Quill decided that a state's ban on physician-assisted suicide is rational as the state is trying to protect a person's life and are trying to preserve medical ethics. Finally, Gonzalez v. Oregon can show a person that the US is moving forward in changing the way they think by starting to legalize physician-assisted suicide. This is because more and more people are starting to think about the feelings of those who are terminally ill. Conclusion. Physician-assisted suicide has been looked down upon throughout American history. However, recently, it has started to gain acceptance. To date, 9 states have fully legalized physician-assisted suicide. This research will help other researchers know what precedents were set in this field currently. Please review our Please look at my literature review for references.